Thank you, Divya. So Divya has instructed me to make it really brief. So this is the way forward. And so Aravind is always known to be patient-centric. And so we follow that in all the aspects of Aravind. So similarly, we also wanted to be more client and stakeholder-centric. So I just want to let you know that before going into the details, this has come through a very collaborative, structured thinking process. We gave more importance to what our stakeholders wanted, and that is the basis on which this goals for the next few years has been developed. Yeah. So we had a retreat, LAICO retreat, to mark the 25th year of existence, and basically the approach we took was we took time to look at the changes that has happened around us, and also we got help from our partners and collaborators in reviewing our current strategies, what works well, what doesn't work, and also that became the basis for setting the new direction. So basically, we have to look at recognize the change that is happening all over. Basically, the population is aging, the economy is changing, technology is coming up in a big way. So we used to talk about telemedicine as a big thing. Now it is everywhere, and it is going forward to machine learning and artificial intelligence, and we have to be on top of that. And there are always regulations that we have to go by. And of utmost importance, the patient's expectations is changing, and the standards of the industry is going up. We usually used to look at reviews when we book a hotel or buy something online. Now the people look at reviews before selecting a hospital to undergo surgery or for treatment. So that's a challenge we have. And human resources has always been a challenge. Having skilled manpower and being able to retain them sustainably. So there also we have to be more efficient, and we have to have ways to scale up training so that we can produce more people in short term. And a lot of people are coming and investing in healthcare. So healthcare is considered to be one of the fields where you have almost assured return on investment. So that is why a lot of people are coming and investing. And government is coming up with new and different schemes, and we have to. So why this is important is we have to. So when we make a plan today, we have to take an entirely different approach than what we would have taken like 20 years ago. So many of those things that we would have planned at that point might not be relevant considering the changing situation. So we have to be aware of what is happening. So we took this into consideration, and we also did a survey of our partners, mostly the INGOs and the other partner institutions, to look at to have an idea about a reality check about what are the challenges in their opinion. So rather than going by our own intuitions, and we also asked people to give some feedback on our services. As you can see on a 5-point scale, people have given their feedback, and as it says, consultancy, training, those activities are doing well, and there are areas for improvement in IT systems and also in developing resources, which are also areas that we are working on. So this is the retreat we had, and we were really fortunate to have the physical presence of many of our partners who respected our invitation and took time to come over to Madurai and then spend a couple of days with us. Some of them are still with us. So we are very thankful. And this is the process through which we developed this way forward. So I just wanted to give you that background. So these are some of the major goals, and we have set like a 5-year period for this. And some of these things, this was set in April this year, and as you can see, many of these things are already have moved forward. So I am presenting it as it was documented in the retreat. So in the consultancy services, we are setting a target of achieving 2 million additional surgeries each year through our partners because of our intervention. And just now we launched the LEAP series. That was one of the decisions that we made in the retreat. And also we have to develop resource materials to support this process. And we have also planned to focus on low-performing districts of India and plan programs. And we are also committed to facilitate the creation of more LAICOs, like organizations. Like we already have been partnering with Seva's initiative to develop the Global Site Initiative. In terms of training, we are planning to start a few new regular courses. Two definite areas where we are starting courses are on Vision Center Management and on counseling. These are also already started. And we also saw examples of going more online. Oro Siksha platform is being revamped, and the target the team has set is to enroll at least 10,000 allied ophthalmic personnel in the Oro Siksha platform. And we are also starting regular online courses. One example is the course on medical records management. And we have also started regular webinars to supplement the regular training programs on specific areas depending upon the need of the participants. And in terms of research, which is an area where we are still looking for more capacity building, we are planning to come up with, aspiring to come up with 10 publications every year, where there will be 2 publications per faculty, where at least one with being the first author. And we are also planning to develop research ideas into workable protocols. So we are going to look at major population-based service projects that we have done in collaboration with many partners, and looking at publication opportunities from those projects. And we are also looking at the possibility of integrating research in the capacity building activities wherever it makes sense. In terms of IT services, the way forward is to go more cloud-based solutions, so that we can make the process more efficient in terms of training and installation and all that, rather than physically being in one place. And we have already started offering online tutorials, especially a lot of hospitals we are working with are in the northern part of India. So we have to have many materials in Hindi to be more effective. And the monitoring system has been improved. And we are also focusing on developing the supervisors and managers for the integrated hospital management software. And also we are looking at developing local partners. We already developed Maimansingh BNSBI hospital in Bangladesh and other centers like Shroff in India. So in terms of universal coverage through vision centers, we are looking at achieving universal coverage for 1 billion people through the vision center model, which we are more than convinced about an approach to take for achieving universal coverage. We already have heard about governments that we are working with in India and outside India. So these are the plans. So in terms of advocacy, these are the broad 4 areas where we have been working. We would like to continue working in these areas, and we want to be more proactive in disseminating preferred practices. And as Dr. Nam was rightly mentioning, so like Aravind Eye Hospitals has always been the laboratory on which LAICO has been developing. We were just conceptualizing and packaging and sharing what has been happening in the hospital. So it's our commitment to contribute back to the system. So we have been doing in whatever way possible, more in a reactive mode, but we want to be more proactive in these areas, in the patient empowerment area, in supporting the MLOP training, and providing a research and biostatistics support, and organizing strategic retreats, which is very important in planning forward, and in the training administration. So apart from the management training programs that we run, we are also facilitating the administrative and logistic management of all the training programs at Aravind, which is about 40 odd training programs. And whenever a new hospital starts, we work with the team in developing a vision and developing the strategies. And we are also facilitating the management of visitors and volunteers in working on different projects. And we have also been involved in developing managers for the hospitals and different departments in hospitals. So these are the this is like a bird's eye view of what we have planned, and as I already mentioned, many of these things are on, and we are already moving forward, and we need your support and encouragement as always. Thank you very much.